and welcome to the Heritage Valley Kennedy School of Nursing Virtual Open House. I welcome you today and welcome your interest in our school. Wanted to give you an idea of what the presentation today is going to be like. My name is Valerie Gaydosh. I'm the director of the Heritage Valley Kennedy School of Nursing, and I'm going to talk to you for 10 or 15 minutes about nursing today and how our School of Nursing can help you be a nurse today. Then we're going to invite you to listen in on a conversation with our admissions coordinator and our financial aid coordinator. After a brief period of time with them, we are going to join you in a classroom with our curriculum coordinator and one of our faculty members to discuss our program a little more in depth so you understand exactly what you would be doing here at the School of Nursing. After that, we will conclude, but we want to make sure that you are aware that you are always welcome to give us a call, to talk to any of the persons that have presented to you today, to come in, to have a visit, to have a personal tour, and I even invite you to come and spend your day with us as a nursing student, joining us in our labs, joining us in our skills, even in the classroom. So we welcome you and look forward to having you here. So what I want to tell you first is nursing has made some great strides in the last 2 or 3 years. COVID made a lot of changes. There is an incredible shortage of nurses today. So the person who becomes a nurse today pretty much so has a wide open door for opportunities in the field of nursing. Unlike many years ago, when you graduate from nursing school today, you are not restricted to just an inpatient medical or surgical unit to kind of get your feet wet before you can move into more specialty areas. Our graduates last May started their professions in ERs, in ORs, in neonatal intensive care units. You can go to any specialty unit now. That was never like that before. Our graduates also, and anybody in this Pittsburgh area, their beginning wage ranged at approximately a minimum of $27 an hour. Yeah, that equates to almost $55,000 a year right out of school, full benefits. In addition, you can pretty much so work anywhere you want. There are jobs available in every hospital system here in the area and even across the country. The shortage of nurses during COVID made our federal government enact a pact between all states that your licenses could cross state lines without being renewed in that state. So the doors are wide open for nurses today. What's even nicer is down the road. You have to always think down the road. So many professions kind of tunnel you into one job. Nursing is not at all like that. Not only do you have the availability to go from being an OR nurse to a flight nurse to delivering babies, you also have the opportunity to continue your education with a 2-year master's program that can leave you a nurse practitioner, can leave you a nurse anesthetist, in education, director of a school of nursing. You can also work in IT, pathology. There's just many avenues that your career as a nurse can continue to expand and grow. But how do we get there? So I'm going to ask our very special IT person here, Rich, if you can put my slide up here so I can discuss with the people what are the options to become a nurse. Again, uniquely to nursing, there are a couple different paths you can take to become a nurse, and they vary greatly. But in the long run, once you graduate, yep, it's this one. Once you graduate, regardless of the path you take, you will sit in a room with all other graduates and take the NCLEX exam. The NCLEX is what allows you to get your license as an RN. But how can we go about that? Well, you can go to a 4-year college or university. It is a 4-year program. It'll cost you about $80,000 minimum. It will take 4 years, and you will graduate with a degree called a BSN, a Bachelor of Science in Nursing. These 4 years accumulate all of the nursing credits you need and all of the general education credits you need to have your Bachelor's of Science. Another route you can go is a trade school or a community college. These schools cost anywhere from $20,000 to $40,000 for their program. The community colleges are much cheaper than some of the other trade schools, and by that I mean like locally we have PTC, which is newly offering an RN program. They take about 24 months. I'm going to tell you to do your research with this because quite frequently the 24 months, 20 months advertised is strictly the nursing program. Community colleges in the area will give you 1 to 2 semesters prior to that nursing program to take your general education courses, which are required for that nursing degree ahead of time, and then you move into the nursing program. Okay? You graduate from those programs with an associate degree in nursing. Sit for the same NCLEX exam as these 4-year BSN students did. The last route is a hospital-associated school of nursing. There's a few options like that in and around the Pittsburgh area. We are one of those. Heritage Valley Kennedy is a hospital associated. We are associated with the Heritage Valley Health System. Most of those programs are the shortest. They're about 20 to 24 months, minimal prerequisites if any. They will cost you anywhere from $20,000 to $40,000 for the whole program, and you will end up with a diploma in nursing. That diploma is no different than the associate degree or the bachelor's degree. You will sit beside those people and take the NCLEX exam to get your RN and get a job along with everybody else. Thanks, Rich. Okay, so Heritage Valley Kennedy, how do we fit into that picture? This is in a nutshell our program. We have a 20-month program straight through 5 semesters. We start at the end of August, and we have a fall course. We move to a 16-week spring course. We have a brief 10-week summer course because we know that you want to get some summer in there. You come back the following fall for 16 weeks, and then the next year in May you will graduate. 20 months, you are done. Unlike some of the other programs, and I said you need to do your homework, we don't require any of your general education courses to be done ahead of time. We have totally incorporated them within our entire program. So those can be done at the same time you are taking your nursing courses. So it is start to finish 20 months. We have about 2 to 3 week breaks in between each of these semesters, a little longer over Christmas. And in the middle of each of these 5 semesters, there is a 1-week break. Pretty much so the middle of the semester in the summer, it is the 4th of July week. So you definitely get your opportunity to still spend some time, friends and family, and get your vacations in with this 20-month beginning to end program. We start our clinicals, which is our students in the hospital, 4 weeks into the program. This is one of the huge advantages of these hospital-associated programs. Being affiliated with the hospital, you will find that even the shorter programs have more bedside student activity hours than even the bachelor degrees. Being associated with the Heritage Valley Health System, we have complete access to Heritage Valley Kennedy, Heritage Valley Swickley, and Heritage Valley Beaver, and all of the areas that they offer. So we send our students to all of those areas. In our school, you will get clinical experiences on med-surg units, in ICUs, in the ER, in the OR. You will go to OB units. You will be in the labor suite. You will care for newborn babies. You will take care of children. You will have mental health experiences in memory care units, in rehab areas. Aside from that, we try to give you some experiences of some of those not so common nursing jobs so that you know what all is out there for you. We spend time in a dialysis unit. We spend time in hospice. Many different areas across the city here, both inpatient in hospitals and community nursing. We like to give you a very well experience of what is out there for you as a nurse. Our class sizes are small, another positive thing of the hospital-based. We have as small classes as 15, as large as about 35 to 40. We never go over 40. We are very personalized with our instructors. Our doors are open on the floor right above the classrooms. We usually have a ratio in clinical and our skill labs of no more than 8 students per single instructor, and a lot of things we do are as small as 3 to 4 students per instructor. Every student is assigned an instructor as an advisor, and all of our instructors are full-time and master's prepared. We don't have people who are not master's prepared educators coming in to teach clinical or to teach parts of a course. We have a full-time faculty. They are the 8 or 9 faculty that you will see consistently. They are all master's prepared. They will lecture to you. They will be in your skills and simulation labs, and they will also be on clinical with you. So we also like to brag that we have a very up-to-date IT system here. Our entire program is via Canvas. Canvas is an online portal where all of your schedules and your courses are downloaded for you to see. And we have a devoted IT tech person for any of our technology problems. So something else, when you graduate from a diploma or a associate degree program, most people do want to continue on to get their bachelor's degree. It doesn't stop you from going to work. What's actually pretty nice about that is you can start working after just 20 months in our program and take a break for a year or two, or roll right in to get your bachelor's. If you choose to do that, most of the hospital systems in this area have tuition reimbursement and will help pay for those extra credits that you need to get your bachelor's degree. For us, the general education credits that we incorporate into our program, we have chosen from the bachelor's degree program to get you the basis that you need to minimize the credits that you will need after graduation to get your bachelor's degree. These are the courses that we incorporate into our 20-month program. If by chance you have any college credits, these may well be able to be transferred, and our admissions people would speak to you about that. But these courses are available. We presently offer them through Penn West. Penn West is the new Cal U, Clarion, and Edinburgh that merged together. The reason that we have joined with Penn West is our original partnership was with Cal U, because Cal U was able to offer every one of these general education courses online, so that our students didn't have to go to another campus somewhere and lose time that they could spend working on their nursing courses, studying for their nursing courses. Having these online give the student the availability to complete their general education assignments at a time that is most convenient to them, at home, on a weekend, maybe during lunch here. But these are the courses that are included. These are pretty similar with other associate degree and other diploma programs. There may be a few that vary, but in the long run, they are the courses that are needed to get your bachelor's degree. So I know that that's a lot of information. In general, you will be with other people who will give you a little more specifics, so you know exactly a little bit more of what our program is like. But that is nursing and Heritage Valley Kennedy School of Nursing in a nutshell. Again, we welcome you to come and see us any day. We'd love to sit and talk with you one-on-one and wish you the best of luck in your nursing future.
Hi, I'm Sharon Gorey. I'm the admissions coordinator here at Heritage Valley Kennedy School of Nursing. I am the first point of contact that whenever you apply to the program, I'm the one that you will be emailing and speaking to. I am going to just run by in general our admissions process, so that way it gives you a little bit of insight of what that entails. So the first form that I would need would be for you to submit the application. Application is just a normal application, just asks for your personal information as far as the address, your email, your phone number, and it will ask for your education. So your high school education, and if you had any college education, it will ask you about that and where did you go. The next form that you will need to submit would be the disclosure form. The disclosure form basically tells you our NCLEX pass rate, our retention rate, and by signing that and submitting that, it's stating that we did disclose that information to you. So the last thing that we would need would be your official transcripts. So your official transcripts I would need from your high school level, and if you had taken anything through college. We are looking for mainly on high school. A lot of students had taken these courses, but we have 3 prereqs that you will need, and they are required. They're algebra, biology with lab, and chemistry with lab. They all have to be passed with a C or higher, and again, we can take from the high school level or we can take from the college level. As long as you passed it with a C or higher, they should be acceptable. We also could transfer credits from other institutions. So if you had taken any college credits and you would like to transfer them in, I can take a look to see if any of them would be deemed transferable. But if you ever want to come in and tour or have an informational meeting, just meet one-on-one, I would be more than happy to do so. So you can just email me or you can give me a call. Thank you so much for attending our open house.
Hello, my name is Tamika Abercrombie, and I am the Financial Aid Coordinator here at Heritage Valley Kennedy School of Nursing. The Financial Aid Office is here to assist you in all of your financial needs. We accept federal and state funding as well as federal direct loans by applying to the FAFSA. The FAFSA is at www.fafsa.ed.gov using our school code 0065600. We also accept VA education, OVR, and other private funding sources. The Financial Aid Office also offers interest-free payment plans, and we can help you to set up a comprehensive financial aid package that is best suits your family's budget and convenience. If you have any questions, please feel free to give me a call, and we look forward to seeing you soon. Thank you and have a great day.
Okay. Hi, I'm Megan Miller. My position here is the Curriculum and Simulation Coordinator. My job is to make sure that the courses flow together and that nobody is on their own little island doing their own thing, and we all kind of just strive along.
Hi, my name is Leslie Brewster, and I am an instructor here at the school. I teach fundamentals, which is the first year. What we teach at the beginning is kind of boring, and the students will say to me, geez, Mrs. Brewster, is this gonna get any more? Are we gonna have fun here or not? But I teach the basics of nursing, like the theory of nursing. I teach you how to communicate to another individual, to your clients. We get into teaching you how to bathe a patient, how to make a bed. Some of us don't know how to make a bed. Our parents are still making it for us. So we would teach you how to make your bed here. Once we get into that, once we get through that, then we go on to our different body systems. And what we do is we teach you in the classroom, we lecture you. Then we take you into the Sims and Skills Lab and we have you do it in a safe environment. And then we take you on the clinical unit for a couple of days and you actually work with a live patient. Megan?
So, like Leslie said, we do our building blocks throughout the entire course to be our foundation. For example, our freshmen learned about the cardiovascular system, which is the heart system. We learned about it in a lecture. We practiced it in the skills lab, and then they actually focused it in on the clinical units. For some of these body systems, we can't control what the units and the patients have over there. So I can't make a patient over in the hospital have a blood clot, but I can bring it back here and put it in our simulator. And like Mrs. Brewster said, that we want it to be a safe environment. So if I'm bringing that back for the simulator to have a blood clot, we want an error to happen there when you're practicing and learning, because we use everything as a learning technique. We build all of this up as our building blocks up to a complete foundation towards the end of the semester, where we do a complete head-to-toe physical exam as our basis for our next course, which is going into the spring semester. And that's when we start having our problem disorders of the medical surgical patient, and then our introduction to our specialties. Our specialties are maternal child and OB, pediatrics, and mental health. Once we start doing that, that is all of the introduction. That is all normal pregnancy, normal childbirth, normal growth and development from the pediatric patient. The mental health, it is how to communicate with the mental health patient, growing on those building blocks that we talked about in fundamentals of building a relationship with a patient. This is specific to mental health. Then we go into our fourth semester, which is the fall semester of their senior year in Nursing 3, and we bring back those specialties, which is again OB, pediatrics, and mental health, but it's all the problems during the pregnancy, problems during childbirth, all of the issues that are going on with pediatrics and our mental health disorders. And it goes well with our clinical sites here at the hospital. We have a geriatric psychiatric unit which focuses on the communication skills that we do in that first introduction to our specialties. Then we go into the acute mental health adult unit on our clinical unit that we can talk about for our problems. Then that leads us into our fifth and final semester, and that is our leadership. This semester is very unique. It is unlike any other semester because the content is probably about 1/3, 1/4-ish of the content that we cover everywhere else, and it's only the first 4 weeks. And then we really focus on getting the student ready for a graduate nurse position working with patients on the floor. And we do that via our preceptorship. And that is done when you work 40 hours a week, paired with a nurse, working days, weekends, nights, off shifts, anything like that, and you have to work such amount of time for our course. We start that off with one patient, and we work our way up to 3 to 4 by the end of our students going through preceptorship. That is followed by an intense NCLEX prep, because our goal here at the school is to make sure that you pass your NCLEX and your state boards on the first try. So we have a faculty-driven review that is based off of standardized tests and contents that we see that are weakened areas throughout the program. And then we take a predictability through ATI, which is our secondary resources that we have here. And that tells us as a cohort the predictability of the students passing on the first try, and then each student gets an individualized predictability. That information goes through back to ATI, and they use that whenever a live representative comes to the school to give their review and an overview of the content areas that the entire class has struggled with. We take that predictability test again to see that if the review process worked and they improved. And then we also have an ATI capstone or virtual that really works with getting that student prepared for taking their boards after they graduate. Because the state board takes a little bit of time before they can actually get their authorization to test. So that you can work on that prior to taking your boards after you actually graduate from the school.
And we do want you to know that you're never alone here. We do have faculty advisors, that we have a group of students that report to us, and we check in with them every 2 weeks. We sit down if you need us to go over the test, where maybe you had missed a question and you needed it explained to you. We also have extra time that we can give you in the Sims and Skills Lab to practice your skills, but you're never alone here. We always want you to succeed. We work very well with our students. We as a group work well as instructors, and there's a great cohesiveness at this school. So we hope that you're interested. We will be taking you down to the Sims and Skills Lab after this, and this is a place where we have a safe learning environment. We want the patient to die. We want to do things and learn from our mistakes, so we're not doing it on the unit. So this is a place where you can actually make mistakes. Things happen, we work on it, we learn how to fix them, and then we prepare you for the clinical unit. So I think you'll enjoy our Sims and Skills Lab.
That concludes our virtual open house for today. I'd like to thank you for taking the time to learn about the Heritage Valley Kennedy School of Nursing. I also want to extend another personal invitation for you to contact our admissions office if you would like to schedule a personal tour, some time to speak to any of the individuals here, or even spend a day with one of our students, exploring our classes, our labs, skills sessions. We welcome you to come visit us here at Heritage Valley Kennedy. Thank you for your time.